When you see the phrase, "your body reacts fast," you might assume we are talking about the pill kicking in instantly. But the reality of your vascular physiology is much more complex. The moment you introduce a medication like Tadalafil into your system, you aren't actually flipping a switch that causes an immediate erection. That is the most common misconception. Instead, you are priming a very specific biological environment to respond to a signal. You see, an erection is purely a hydraulic event. It is a game of pressure. And for that pressure to build, a rapid chain reaction has to occur involving your nervous system, your blood vessels, and a crucial molecule called nitric oxide. If any link in that chain is broken, or if the chemical signal fades too quickly, the hydraulics fail. What we are going to explore today is the precise mechanics of that chain reaction. We are going to move past the superficial explanation of it increases blood flow and look directly at the cellular level. We need to explain how nitric oxide triggers the release of a messenger called cGMP and why Tadalafil doesn't actually create the erection. It simply prevents your body's own enzymes from killing it. We are going to walk through the pharmacokinetics, the timing, and the vascular valve system that determines success or failure. By the time we finish, you will have a complete understanding of how your biology interacts with this chemistry. To understand how the medication works, we first have to respect the machinery it operates on. The penis is, for all intents and purposes, a specialized vascular capacitor. It stores blood pressure. It is not a skeletal muscle like your bicep. You cannot willfully contract it to make it grow. In fact, the mechanism of an erection is somewhat paradoxical because it requires deep relaxation to create rigidity. Let's look at the anatomy. Inside the shaft, you have two cylinders of spongy tissue known as the corpora cavernosa. Think of these as vast networks of empty spaces, potential reservoirs waiting to be filled. Surrounding the tiny arteries that feed these reservoirs are smooth muscle cells. These are the gatekeepers. In your normal, flaccid state, these smooth muscle cells are contracted. They are tight. They act like a clenched fist around the hose, restricting blood flow to a bare minimum, just enough for nutritional maintenance, but not enough for expansion. This state is maintained by your sympathetic nervous system, often referred to as your fight or flight system. As long as these smooth muscles are tense, the blood stays out. This is the fundamental hurdle. For an erection to occur, that tension must be broken. The smooth muscle must surrender its grip and relax. When it relaxes, the arteries widen, a process called vasodilation. The resistance drops and arterial blood rushes into those spongy cylinders at high pressure. As the sponge fills, it pushes against the outer sheath of the penis, trapping the blood inside. So, the entire biological goal of an erection is simply to tell those smooth muscle cells to let go. If they don't relax, or if they tense up prematurely, the blood drains out and the erection fails. This brings us to the chemical signal that commands that relaxation. This brings us to the critical molecule mentioned in the thumbnail, nitric oxide or NO. Nitric oxide is the spark plug of this entire engine. Without it, the biological machinery remains dormant. When you experience sexual stimulation, whether it is physical or psychological, your brain sends nerve impulses down the spinal cord to the pelvic region. These nerve endings, along with the endothelial cells that line the inside of your blood vessels, release a burst of nitric oxide. This is a gas, and because it is a gas, it diffuses rapidly across cell membranes. It travels instantly from the nerve endings and the vessel lining directly into those neighboring smooth muscle cells we just discussed. However, nitric oxide itself does not cause the erection. It is merely the messenger. Once inside the smooth muscle cell, nitric oxide binds to an enzyme called guanylate cyclase. Think of this enzyme as a factory. When nitric oxide hits it, it switches on and begins converting a molecule called GTP into cyclic guanosine monophosphate, or cGMP. I want you to remember that acronym, cGMP. This is the most important chemical in the equation. cGMP is the actual fuel for the process. It is the intracellular signal that tells the smooth muscle machinery to sequester calcium. When calcium levels drop inside the cell, the muscle fibers slide apart and relax. As cGMP levels rise, the smooth muscle walls of the arteries dilate aggressively. The vessels widen significantly, dramatically increasing the diameter of the path blood can take. This is vasodilation in action. The resistance drops to near zero, and arterial blood surges into the corpora cavernosa. So, the equation is simple. The more nitric oxide you produce, the more cGMP is generated. The more cGMP you have floating around inside those cells, the more relaxed the vessels become, and the harder the erection. It is a direct correlation. But nature demands balance. You cannot have vessels that stay dilated forever. That would cause tissue damage. So, your body has a built-in braking system designed to degrade cGMP and turn off the erection. And that is where the problem and the solution lies. Enter the antagonist of our story, an enzyme known as phosphodiesterase type 5, or PDE5. This enzyme patrols the smooth muscle cells with a single directive to break down cGMP. PDE5 is catabolic. It acts as a cleanup crew. Its job is to find the cGMP molecule, break the chemical bond, and render it inactive. Once PDE5 degrades the cGMP, the signal to relax is lost. Calcium floods back into the cell, the smooth muscle contracts, the fist tightens around the vessel again, and the erection subsides. This is known as detumescence. Now, under normal physiological conditions, this is a necessary process. You cannot maintain an erection indefinitely without damaging the tissues due to lack of oxygenated blood circulation. PDE5 exists to ensure that the system eventually resets. However, the problem arises when the balance between production and destruction is tipped in the wrong direction. The most effective way to visualize this mechanism and the root cause of erectile dysfunction is to think of your erection like a bathtub. The water flowing from the faucet represents the cGMP being produced by your body. The level of water in the tub represents the quality and rigidity of the erection. The drain at the bottom of the tub represents the PDE5 enzyme. In a perfectly healthy system with high libido and strong vascular health, the faucet is wide open. You are producing so much cGMP that it overwhelms the drain. Even though the drain is open and water is leaking out, the tub fills up because the inflow is faster than the outflow. However, as we age, or if we have vascular issues like diabetes or hypertension, the faucet slows down. Our endothelial cells produce less nitric oxide, meaning we generate less cGMP. Simultaneously, the PDE5 enzyme, the drain is still wide open. Now, the water drains out faster than you can pour it in. You might get a partial fill, a semi-erection, but it drains away quickly because the chemical signal is being metabolized too fast to maintain pressure. This is the metabolic trap of ED. It isn't necessarily that you have broken parts, but rather that the equilibrium between the gas pedal, cGMP, and the brake, PDE5, is lost. The body is dismantling the erection signal faster than you can create it. This is exactly where Tadalafil intervenes. It doesn't fix the faucet. It plugs the drain. When you ingest Tadalafil, the molecule travels through the gastrointestinal tract and enters your bloodstream. Unlike local injections that work only at the site of administration, this is a systemic medication. It circulates throughout your entire body, but it is chemically designed to seek out and bind to specific receptors found predominantly in the vascular smooth muscle of the penis, the PDE5 enzyme. Here is exactly how the interaction happens at a molecular level. This is the mechanism that defines the drug. Tadalafil works through a process called competitive inhibition. If you were to look at the chemical structure of cGMP, the fuel for your erection, and compare it to the chemical structure of Tadalafil, you would see a striking resemblance. They are shaped very similarly. This structural similarity is the key. The PDE5 enzyme has a specific active site, which is like a keyhole designed to accept the cGMP molecule so it can break it down. Tadalafil acts as a decoy key. Because it looks like cGMP, it fits perfectly into that keyhole on the PDE5 enzyme. However, once it slots in, it doesn't break down. It gets stuck. It effectively jams the gears of the enzyme. By occupying that active site, Tadalafil prevents the PDE5 enzyme from latching onto the actual cGMP. Let's go back to our bathtub analogy. Tadalafil acts as the rubber stopper for the drain. It doesn't matter if your faucet, your natural production of nitric oxide, is dripping slowly due to age or health conditions. Because the drain is now plugged, that slow drip is allowed to accumulate. The water level rises because the outflow has been blocked. This allows men with compromised vascular systems to build up enough intracellular cGMP to achieve a rigid erection, something that would be impossible if the drain were left open. However, this mechanism reveals a fundamental truth that many patients misunderstand, leading to perceived failure of the medication. Tadalafil is not an aphrodisiac, and it is not a switch. It does not turn on the faucet. Remember, the faucet is opened by nitric oxide, and nitric oxide is only released through sexual stimulation and arousal. If you take Tadalafil and sit in a chair staring at a wall, absolutely nothing will happen. Why? Because without stimulation, there is no nitric oxide. Without nitric oxide, there is no cGMP produced. And if there is no cGMP produced, there is nothing for the Tadalafil to protect. You have plugged the drain of an empty tub. The medication creates the environment for an erection by disabling the braking system, but it still requires you to push the gas pedal. It amplifies the biological signal you generate. It does not create the signal from scratch. This distinction is vital because it dictates how you should time the medication and what you should expect regarding its duration and onset. This leads us to the pharmacokinetics, the study of how the drug moves through your body over time. This is where we address the reacts fast aspect mentioned in the thumbnail and, more importantly, the unique duration that separates Tadalafil from every other competitor in this class. When we talk about speed, we are talking about Tmax, or the time it takes to reach maximum concentration in the blood. For Tadalafil, this window is typically between 30 minutes and 2 hours. While some men will feel that vascular switch flip within the first half hour, the peak saturation usually hits closer to the 2-hour mark. This is why timing matters. If you expect an immediate result within 5 minutes of swallowing the tablet, you are misunderstanding the absorption rate. But the real superpower of this specific molecule isn't speed, it is endurance. This is defined by its half-life. The half-life of a drug is the time it takes for the concentration in your blood to drop by 50%. To put this in perspective, sildenafil, the famous blue pill, has a half-life of about 4 hours. That means 4 hours after taking it, half the drug is gone. 8 hours later, it is mostly negligible. It requires you to plan your intimacy within a very tight, often stressful window. Tadalafil is different. Its half-life is approximately 17.5 hours. Because of this slow elimination rate, the drug remains effective in your system for up to 36 hours. This is why it earned the nickname the weekend pill. You can take a dose on Friday evening, and on Sunday morning, there is still enough of the medication blocking those PDE5 enzymes to facilitate an erection. This reintroduces the element of spontaneity that ED often steals from a relationship. You are no longer watching the clock. This long half-life also unlocks a different therapeutic strategy, the daily low dose. When you take a large dose of a short-acting drug, your levels spike and then crash to zero. It is a roller coaster. However, if you take a small dose, say 2.5 or 5 milligrams of Tadalafil every 24 hours, you leverage its long half-life to achieve what we call a steady state. Because the drug stays in your system for so long, the next dose comes before the previous one has fully left. After about 5 days of this, the levels stack on top of each other and level out. You eliminate the peaks and valleys. You effectively have therapeutic levels of the drug in your bloodstream 24/7. This constant inhibition of PDE5 has a secondary benefit beyond just being ready for sex. It facilitates better nocturnal erections. Sleep erections are your body's way of running maintenance on the penile tissue, bringing oxygenated blood into the corpora cavernosa to prevent fibrosis or scarring. By keeping the drain plugged slightly all the time, you improve the overall oxygenation of the tissue, potentially preserving function in the long term. Now, even with the best pharmacology in your system, biology can still veto the process. There are specific external and internal factors that can ruin the flow we just described, effectively neutralizing the medication regardless of the dose. If you don't account for these variables, you are setting the drug up to fail. The first variable is your digestive environment. One of the major advantages of Tadalafil over sildenafil is that it is not strictly food dependent. However, physics is still physics. If you consume a massive, high-fat meal, a heavy steak dinner, or fried food immediately before taking the medication, you are creating a traffic jam. Your body diverts significant blood flow to the digestive system to manage that caloric load, and the fat content can coat the lining of the stomach, delaying the absorption of the drug into the bloodstream. It might not stop it entirely, but it introduces a lag time that can be frustrating. The second factor is alcohol. This is a common trap. While a drink might help you relax psychologically, alcohol acts as a central nervous system depressant. It numbs the very nerve endings responsible for sending the initial arousal signal. Furthermore, in high amounts, alcohol promotes vasoconstriction, the narrowing of blood vessels. You are essentially drinking a chemical that fights the very expansion Tadalafil is trying to protect. But the ultimate killer of erections, the one factor that overrides everything else, is adrenaline. Remember earlier when we talked about the sympathetic nervous system? The fight or flight mode. Adrenaline is the chemical driver of that system. Its biological purpose is to constrict blood vessels to shunt blood to your muscles for survival. It is the direct physiological opposite of nitric oxide. If you are stressed, anxious about performance, or worried about whether the pill will work, your body dumps adrenaline into your bloodstream. Adrenaline clamps down on the smooth muscle cells. It creates such intense chemical tension that even Tadalafil cannot overcome it. You are essentially trying to drive the car with the parking brake pulled all the way up. The engine might be revving, but you aren't going anywhere. To get the best results, you have to manage the anxiety just as much as the chemistry. So, here's the big picture. Tadalafil is a remarkable tool. It allows us to manipulate the timing of our biology and restore function where it has been lost. But you must understand that it is just that, a tool. It acts on the symptoms of vascular decline, but it does not cure the root cause. Remember, this medication can only protect the nitric oxide you are actually able to produce. If your lifestyle, your diet, your sleep, your cardiovascular fitness has degraded your endothelial cells to the point where they cannot produce that initial spark, no amount of medication can bridge that gap. The pill supports the vessel, but your health supports the pill. And honestly, that is where most men get stuck. They have the pill, but they've lost that natural spark. If you feel like your system needs a hard reset without relying on synthetic chemicals forever, you need to see a presentation I found regarding a bizarrely simple 7-second morning ritual. It involves a specific purple hardening tonic that is designed to naturally reactivate that nitric oxide production we just talked about, effectively targeting the root cause rather than just treating the symptom. I've put a link to a video that explains exactly how this tonic works. You can scan the QR code on your screen right now with your phone camera, or simply click the link I have pinned in the top comment below. If you want to stop depending on the pharmacy and start fixing the plumbing yourself, go watch that now. If you want to get the most out of this chemistry, you have to respect the biology behind it. Keep the plumbing clean, keep the signal strong, and use the medication as a strategic aid, not a crutch. Understanding how your body works is the first step to making it work for you.